think about where hormones are produced. They're produced in the ovary, and they're also produced in the periphery, like the adrenal glands. I told you by the time you're 40, your levels are already at about half of what they were previously. So if your ovary can't produce it, where in the body might you make more testosterone? Common sense just says if the adrenal glands are working harder, putting out more adrenaline, then sometimes people may be a little more edgy. Think about these women that say, I don't know, all of a sudden I can't sleep at night. I worry, is the door locked? Did I do this? And you go to bed at night and you close your eyes, but you can't really sleep because your mind is just going 100 miles an hour. So some of that can be, brought back to hormones that are imbalanced. Once we balance those hormones, and a lot of times people will say, gosh, I slept good for the first time in years.
Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of 3. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Hi, everyone. Thank you so much for joining us today. I have a very special guest, Dr. Stacy Hammond, who will be joining us today. Stacy.
Hi, how are you?
I'm good. Thanks for joining us. So I am really excited to be talking about hormone replacement therapy. I feel that this is an area of medicine that in a way has failed us with the lack of information. And I'm just excited to get more information out to people and have them explore the opportunities of how it can benefit them in the aging process and help them feel more like themselves as
Absolutely.
well.
I will tell you from a clinical perspective, many of our clinicians in the field aren't adequately prepared to discuss or engage with people about hormone therapy. In fact, I'll share one statistic with you. The Mayo Clinic did a study in 2019 interviewing interns about hormone therapy. What they found from that study is that only 6.8% said they felt confident to talk about hormone therapy. Now, this was just any interns. These were OBGYN and internal medicine. And
oh my goodness.
One more thing, what was more astonishing to me is that 2/3 of those said they wouldn't treat a symptomatic menopausal woman even if she had no contraindications. And that clearly tells me that there is misinformation out there and people that are need more education about hormone therapy, including our population and people we're talking to today.
Correct. Those are staggering numbers. But I also wanted to have you tell people who might not know who you are today a little bit more about your background, your experience. Go ahead.
All right, sure. So I've been a nurse practitioner for over 28 years in practice. Spent a great deal of probably the last 2 decades in women's health, gynecology, and treating hormones, even in men. And prior to that, I had a lot of time in critical care and cardiology. And it's funny because back then, probably 28, 30 years ago, I spent all this time treating patients with Band-Aids, more or less finding pharmacological treatments for their symptoms. Never did I really understand how important hormones were for treating the underlying root cause of all these diseases that can manifest later in life.
Oh, wow.
It was kind of eye-opening. So now I'm actually the director of clinical services at BioT Medical, and my job is to help educate other clinicians so that they can learn the things that I didn't know back then, help them be more responsive to their patients and understand that many times these symptoms are not just because they're aging, but it's because their hormones are changing throughout their lifespan.
I went to the 4 a.m. conference in Vegas back in December, and I was listening in to one of the doctors who was a huge advocate in hormone replacement therapy. She was in her mid-70s, best-looking grandma.
Yeah.
I'm sure she had a mini skirt on and everything. And she said that, and I won't forget this, that, being a provider and not offering hormone replacement therapy to patients who need it is really doing a disservice to them, as you had mentioned. And it's almost like an analogy of when a woman hits menopause, it's like shoving her off the cliff, and all of these emotions and changes that are happening in the body are so radical that they don't know where to go.
Clearly, we know that just looking at literature, because most of the literature surrounding hormone therapy, for example, testosterone, is in the male population. Now, one interesting point I'm sure you're going to lead into it, is that when we think of hormone replacement, we simply, in women, think of estrogen.
Yes.
But a staggering fact for people who may not know is that in our lifetime as women, we produce 3 to 4 times the amount of testosterone as we do estradiol. And when you hit about 40, more than half of that is depleted. So these women in their mid-40s who are not menopausal, but they wonder, why can I not sleep at night? I'm screaming at the kids. I can't focus at work. Belly fat. I can't think clearly. Why did I walk into the room? Where did I leave my purse? All of these things many times can be related to imbalanced hormones.
Yeah.
And it gets overlooked.
And we're told that, that's part of aging. And
absolutely. Or you just need an antidepressant, honey, and everything will be fine.
Yeah. Yeah. I mean, I was one of those patients when BioT came into our clinic, and I was educated about hormones. And my initial thought, which now I know is a misconception, is that I have to be menopausal or premenopausal to even consider hormones. And the first thing the rep had said was, absolutely not. Your hormones start dropping off. What is it, in your 20s or late 20s?
Absolutely, sure.
Yeah. And as long as you're not looking to have babies, then now is a time to start.
Yeah, perimenopause is really the most important time to be proactive at optimizing these hormones, because it's at that period that the brain can be most vulnerable to changes that occur later in life. So studies will tell us overwhelmingly that the earlier and the sooner you start, the better for longevity.
Yeah. Now, walk me through a patient that might come to you and say, Dr. Stacy, I'm considering hormones. I'm done having kids. I'm not menopausal yet. What are my options? So walk me through that process if I were to come to you.
Well, there's almost 2 sets of patients. One set will come in and say, I want to get on hormone therapy. I have hot flashes and sweats. I'm not sleeping well, and I want to do hormones. Or they may even say, I want to do something more natural. The second patient that may come in has no idea. She comes in and says, I can't sleep. I don't want to have sex. I can't have orgasms anymore. My brain is cloudy. My kids irritate me. My coworkers are idiots. What's wrong with me? Something's wrong with me, but I can't put a finger on it. Everywhere else I've gone, the doctors or clinicians have told me that I just need an antidepressant.
It's funny. That sounds like majority of people that are on antidepressants.
And many times people get put on that because someone doesn't understand what is going on with these hormonal challenges. We have in our office a sheet that is basically a health assessment sheet that will ask them to rate their symptoms, mild, moderate, severe. And it'll be things like joint pain, brain fog, sleep, weight gain, dry skin, female sexual desire, all of these things. And you'd be surprised how many people have really no idea why I'm asking the questions or what it correlates to. So when these patients come in, we'll take a look at this health assessment, and then we'll talk to them about, look at their health history, do a physical exam, and then talk to them about, first of all, what brings you here? What is it that you're hoping that you can achieve? And then we'll sit down and outline a plan based on their lab work that we get. We'll sit down and outline a plan of what may be best for them. Everyone's different. Everyone's unique. So it's a personalized, tailored plan for each individual.
Okay, so they complete the questionnaire, and let's say majority of the questions are showing that they have moderate or severe symptoms. What's the next step? Do you recommend a blood work, like labs?
Absolutely. So the next step is we want to get lab. And we do lab for a couple of reasons. One is we're trying to rule in or rule out a diagnosis. But the second reason is that we're looking to use that as a baseline and then monitor therapy. After we start therapy, it gives us some guidelines to stay within.
Can we talk about the different types of hormones?
Absolutely.
I know BioT does the bioidentical hormone replacement therapy, which is my favorite. And there are also the injections and the creams. Can you just briefly talk about all of those?
That is important to distinguish because oftentimes when you say hormone therapy, or even if you read literature about hormone, you have to stop and ask yourself, wait a minute, what type of hormone are we talking about? Because insulin's a hormone, testosterone, estrogen, estradiol, and then you have to determine, is this a synthetic hormone or is this a natural or bioidentical? Because there is a difference. There's a difference in how they're metabolized in the body. And even when we look at orals, many synthetic orals can increase inflammatory markers. And that's important because let's say a 60-year-old woman comes in who has hypertension, maybe early signs of cardiovascular disease, and you want to help her because we know hormones can be helpful and protective for the cardiovascular system, but yet you prescribe an oral medication, and oral synthetic hormones are known to increase inflammatory markers. So did you do this patient a service or a disservice? And so when we look at the different modalities that are out there, many of the orals are synthetic. Now, there are a few that are bioidentical. Then there's patches, gels, and creams, and the majority of those can be bioidentical. But, every patient is different. So there's pros and cons with each avenue. With a patch, someone may say, well, I sweat, they're itchy, they bother me. So there's some drawbacks there. And then injectables, of course, but someone has to be willing to stick themselves with a needle.
That's a
sometimes
big needle.
Multiple times a week. And that gets old after a while for some individuals. Plus, if you think about it, your ovaries, or if this is male population we're talking about, your testicles have never said, it's 2:00, it's time to release hormone. Ding. It's 4:00, it's time to release hormone. And if we think about injectables, that's really what happens, is it's a sudden release. Now, what I love, and I will tell you probably 95% of my patients in my clinic use bioidentical pellets. So pellets are pure estradiol, pure testosterone. They are inserted under the skin, and then a capillary body or blood forms around them. So every time the heart beats, I say it's kind of like a kid licking a lollipop. So every time the heartbeat goes, the blood circulates around this pellet. So it's released in more of a rhythmic nature, kind of like what the body does.
Used to.
When we exercise, our heart rate goes up, so we get more hormone taken up. It's the same way when we have pellets under the skin. That's why a lot of my people really love that modality. Plus, it's convenient, 2-3 times a year for most patients, so it's very convenient.
It is. And the procedure is not that long, right? It's
very simple, easy procedure, just a little local injection, little steri strip after we put the pellet under the skin, and they're back in business within probably 5 minutes for a female procedure. Quick and easy.
some of the questions I have people ask me is, what if I have the pellets inserted and I don't want them? I've had patients come in and say that, and what we say to them is, you probably won't have that response, because after a few days, the first symptom that you've been complaining about the most will typically be the first symptom that goes away.
Sure.
Correct.
So this is why it's important to have patient involvement as part of the decision making. If someone says, I don't want that, I'm probably not going to twist their arm to move them in that direction, because there are other reversible modalities like creams and gels. But what I find a lot of times with patients that go that avenue, they may do that and then they may come back and say, this is just not achieving the results that I want. And so if that's the case, then they may be more open and applicable to move toward a pellet. Now, I told you there's pros and cons with each one.
Yes.
And with a pellet, once it goes under the skin, it's not like, if you change your mind, we'll go dig it out. So this is something that we want to be sure that this person tolerates it and that they do well. But again, it is pure natural estradiol or testosterone. In essence, I'm putting back in you what's already in your body. The key is that you keep those levels therapeutic, that you really manage them appropriately. And that's what we train at BioT. We teach you how to manage those levels, because it's much different than managing pills or injections. So again, to your point, the beauty of pellets is, especially with these estradiol, within about 3 days, it's on board. These women that have been suffering with hot flashes for years, using all different forms, we put pellets in them, and many times within 3 days, they're like, oh my goodness, you've changed my life. And a few days later, then the testosterone portion kicks in. So sometimes it may take a round or two to get all these symptoms at bay. But what we see is that once we figure that out, get these pellets in, get these levels balanced out, it's a game changer. And again, I've been doing this for 12 years with BioT. I've never seen patients respond so positively with pellet therapy as I have with other treatments.
I remember you mentioning when you came into clinic a few years ago, you said, Johanna, if anything, I've had people say they wanted more hormones and not less.
I've had one patient say, I will mortgage my home before I lose my BioT. And this was a little lady on a fixed income that it was such a game changer for her. And patient after patient, I have husbands say, I don't care what it costs, you keep getting your hormones. This has really changed our relationship and it's changed your life. And I can see that. And it is money well spent. It's about quality of life for these individuals.
Yeah, it's amazing. I want to go and talk about this Women's Health Initiative study. Back in 2002 that did this area of medicine such a disservice and pretty much scared a lot of practitioners and even patients into getting this type of therapy for themselves. Can you talk a little bit about that study?
The statistic that I gave you earlier about those residents and interns that were afraid to treat people, it stems from a study that's over 2 decades ago. And what didn't make the New York Times and what didn't make the news is the fact that years later, in 2017, they actually came back and refuted that study. They said it was flawed. And the reason that happened is because many really knowledgeable physicians challenged that study. And what they did was they collected data that was raw data. And what I mean by that is, if you look at a population and you say, oh, so many people had a certain incidence, but then if you go look and see, well, of those people, there were a lot of people that had diabetes, a lot of people that smoked, they were overweight. So you have to risk stratifying. You have to really apply statistical analysis to get true information. So that women's health study from 2 decades ago has been refuted, and there were new papers that were written saying that it was flawed. In fact, the fear that us women had is that hormones cause breast cancer. What they found is that even using a synthetic estrogen, the rates and incidence of death and incidence of breast cancer dramatically decreased. In fact, 44% less likely to die of breast cancer.
That's crazy.
And using bioidentical, there was a later study that was a Finnish study that was done in Finland. They actually showed up to 54% reduction of death if they were on bioidentical hormones. Now, what that means to me and you is that if I had a crystal ball and I knew you were going to get breast cancer down the road, I would encourage you to be on hormones, not run away from them, but actually be on estradiol, bioidentical estradiol. And the studies will show the sooner you are on it, the better the outcomes.
That's what I'm hearing. And this study has still cast a shadow. We have patients coming in that are afraid of this. I will give an example of my mom, for instance, whom you've met, who is a cancer survivor, breast cancer survivor. And she was on no type of hormone replacement therapy. And when we brought BioT into the clinic and she was educated on this, we started putting her on hormones, and she immediately, within days, started sleeping better, feeling more like herself. So can you talk more about patients that might have had cancer, that are afraid to get hormones, and talk about the benefits?
Yeah. One thing that I would say is I'm certainly not an oncologist. And one of the things we teach at BioT is if someone has had cancer, we certainly want collaboration with oncologists. Now, most of them, depending on the type, this can get a little muddy here when we talk about types of breast cancer, whether it's estrogen receptor positive or negative. But most of the time, they're not going to be candidates for estradiol when they've had breast cancer. However, testosterone is a different different thing. So testosterone can be very helpful for these women. What I find in my gynecology practice is that they've often been cast to the side. Once they've been diagnosed with breast cancer, they just have to deal with bone loss, cognition issues, cardiovascular risk, and just quality of life. Think about protection of bones. So these patients do very well with testosterone therapy because it can, in essence, really be helpful for bones. It can be very protective for their heart. We know testosterone can help decrease inflammatory markers. If you think about the root cause of any disease, whether it be cancer, diabetes, cardiovascular disease, the root or the underlying issue is inflammation. It's inflammatory cells. So testosterone can give them life again. They can really improve their sexual well-being, their bones, and their sleep. So there are many benefits for these breast cancer patients. It's probably my favorite cohort of patients to treat because you can really give them quality of life and hope again.
Yes, my mom is a prime example, and she loves
Love your mama. Yeah.
I want to talk more about hormone replacement therapy and the benefits on maintaining bone density. And can you talk more about what happens to our bodies for women as we hit menopause and that drop in hormone, how that affects our bone structure?
So the first thing I want to really make a comment about is when these women say, oh gosh, I don't want to be on hormones because I'm afraid of breast cancer, right? And then we think about the other diseases that women encounter as they age, and cardiovascular disease is still the number one killer. 9 times more women die of cardiovascular disease than breast cancer. But let's talk about bone loss. So what we know is that bones start deteriorating very early, even in our 30s, they start declining. Studies will tell us if a woman, let's say over 60, a woman falls and breaks a hip, within 1 year, 25% of those women are going to die as a result of complications from hip fracture. 25%. It's staggering. So what if there was something we could do to be proactive instead of waiting till she gets to that point and then filling her full of a lot of drugs that have a lot of side effects? What if we could be proactive? What we know about estradiol is that it keeps the bones from breaking down. There's something called osteoclast and osteoblast. And basically in your bone, there's a component that breaks bone down, and then there's another component that builds bone up. Estradiol helps prevent bone loss. Now, so it's indicated for prevention of fractures. Progesterone can actually help build bone. There was a study done years ago by Susan Davis that showed when you add testosterone to estradiol, you have cumulative effects on not only preventing bone loss, but adding to bone growth. So testosterone combined with estrogen can really be beneficial to help build bones.
Yeah, and if I recall, BioT had mentioned that pellets were the only type of hormone replacement therapy that could increase bone density by up to 8%.
Well, I'm always careful when I say only or never or always, but yes, it was a very small study, but it looked at increase. Yes, and of course progesterone does that as well, but testosterone can be very beneficial for these women at building bone.
I want to go also talk back about the underlying diseases that you had mentioned that were helping patients when you were primarily working in cardiovascular, and then realizing, wow, this hormone replacement therapy is helping prevent certain diseases. What were those diseases? Cardiovascular, obviously.
Yeah, so certainly with cardiovascular. There are also studies, but again, and many of the studies that we're going to talk about were done in men. So we, sometimes have to extrapolate some of that to women because there are there's only few studies out there looking at androgen therapy or testosterone therapies, when I say androgen, in women, because it's kind of, it's just not something that that we find in literature as prominently as we do in men. But what we know is that even risk of diabetes can go down because testosterone can help with insulin resistance and insulin sensitivity. So if you can help in that regard to make the body's insulin more beneficial, then it can help lower blood sugars. And in essence, there are studies that show it can maybe help prevent the progression of diabetes. Testosterone also helps lower inflammatory markers. I looked at some studies during COVID a few years ago because I was quite interested in that. And again, this was in male population. But what they found is that those patients that were hospitalized in the ICU, they started looking at testosterone levels. What they found is that the higher the testosterone level was, the less likely they were to stay in the hospital on ventilators. So in other words, people who had lower testosterone had a worse outcome or more progression to ARDS, adult respiratory distress syndrome. So they had more problems, and they were in the ICU longer and on a ventilator longer when their testosterone levels were lower. Again, it's just common sense. Testosterone decreases inflammation. And again, inflammation is the root cause of many of these diseases.
Yes, that's right.
So testosterone can be beneficial for bones, can be beneficial for heart, and there are some studies that show that it's actually beneficial for breast, protective against breast. Small observational studies, and again, it's a little unethical to line people up, and in some accounts, breast cancer studies can be difficult. And when it comes to cognition, there are many studies that show it's very beneficial. Some show that it's kind of neutral. To do appropriate study, it would take over 20 years. So unfortunately, there's not a lot of studies out there that can meet those qualifications to get us really good data. But anecdotally, there are many clinicians that will tell you patients will report their cognition significantly improved when they're on hormone therapy.
I think that's very interesting. One of the things that I've learned just from the short time we've been talking is, and not realizing is, I did a podcast on depression and anxiety, and those staggering numbers increasing. And part of me is, as we're talking, is asking myself, what percentage of that population is actually really depressed, and what percentage of that population needs this hormone replacement therapy so that we can actually treat the underlying
Probably
problem.
A lot. You know, that questionnaire brings in a lot of people who have no idea that their symptoms correlate. I want you to think about, you see pregnant women sometimes, and don't we often say, gosh, they just have such a glow about them, right?
Yeah.
Do you have any idea what you think that glow might be from?
Well, they're pumped with all these hormones.
Exactly. So when you talk about anxiety, we know a lot of times things like progesterone, in some people, everybody's wired a little bit differently, but in majority of people, it'll affect on the GABA receptor. Now, what GABA is that receptor that helps people relax. It's kind of like having a glass of wine in the evening to wind down. So it can help, in essence, with some anxiety, sleep disturbance, and testosterone can be beneficial to help people sleep too. When you think about where hormones are produced, they're produced in the ovary, and they're also produced in the periphery, like the adrenal glands. Okay, so think about if your ovary, I told you by the time you're 40, your levels are already at about half of what they were previously. So if your ovary can't produce it, where in the body might you make more testosterone? The adrenal glands. And then, common sense just says if the adrenal glands are working harder, putting out more adrenaline, then sometimes people may be a little more edgy. Think about these women that say, I don't know, all of a sudden I can't sleep at night. I worry, is the door locked? Did I do this? And you go to bed at night and you close your eyes, but you can't really sleep because your mind is just going 100 miles an hour. So some of that can be, brought back to hormones that are imbalanced. Once we balance those hormones, and a lot of times people will say, gosh, I slept good for the first time in years.
That was me. Yeah. 4 days after I had the pellets, I felt, and I was one of those, I have 3 children, ages 7 and under, set of twins.
Oh, wow.
And people just told me, be prepared to never sleep until they're out of your house. And so I took that as truth.
Thought that was just the expectation.
That's just what happens when we age. And when I had the pellets, the BioT pellets, I felt amazing after 4 days. I had energy. I felt my body again. I was like, I have a vagina. This is great. And I just felt normal. I felt good.
When I first came to the training, over a decade ago, I sat there and listened to clinicians give these examples over and over. And I thought to myself, because I'm a bit of a pessimist. I don't believe everything I hear. I thought it was too good to be true. Too good to be true. All this stuff can't really happen. So I go home, I treat my very first patient, and I remember she came back in 6 weeks later to get her blood drawn. She had come by herself the first time. When I opened the door and walked in, her husband jumped up out of the chair, ran over, shook my hand, hugged my neck, and said, "Thank you for giving me my wife back."
Oh.
I hear these stories over and over with the beauty. And so what I say to women is don't accept, if you're seeing a clinician and they say, you're just aging, this is just part of aging, you're not supposed to have a sex drive, you're not supposed to, have the energy you had before, it's just part of aging, find another clinician.
Yeah, that's a
Find
horrible
somebody that's
story.
going to listen to you and have shared decision-making with what you really want.
That's a horrible story we tell ourselves.
I know.
And it's so prevalent right now. We do need to take care of ourselves. And I think this is so important that, that as we age, primarily a lot of patients that are coming in with the symptoms we're describing on this sheet, the screening questions, they're not getting answers. So what message would you give providers that might be listening to this, that are afraid, that are in that 2/3 population, that are afraid? What can they do to start doing better?
It's like me. I always thought for every symptom, there's a pharmacological agent. There's a prescription to fix this pill and fix this problem. And there probably is. There's a prescription to treat just turn the TV on. You'll see it. But what I didn't understand and what I would convey to providers out there is you always want to think about what's the cause. If I just put a piece of tape over a hole in a bucket, I haven't really fixed the leak. I have to think about what the underlying cause is. Mm-hmm. And we know that hormone imbalance can be key to that. If you still think that hormones cause breast cancer, you need to go back and look at the data, look at the research, because that is not the case. You're doing your patients a disservice. So I would encourage them to seek opportunities to learn about hormones, learn science-based, evidence-based information. And we offer that at BioT Medical.
And
they'll learn.
Yes, and I think this speaks for the message that we have and that I want to give, that we have to be our own advocate.
Absolutely.
We can't, the information is so readily available online. Do your research, be your own advocate, and get the truth, get the most up-to-date information. My daughter always says to me when I'm scrolling through Facebook and I see something, go, "Oh, that's it." She says, "Now, Mom, is that real or is that AI?" Like sometimes you can't believe everything you see or hear. So when you hear or see people that say hormones cause cancer, I would stop and question that. Is this real or is this imaginative? Is this someone that is speaking to us from information that was 20 years ago? We used to give aspirin to babies and we thought that was okay. Science changes, the information that we have changes, and women need to be their own advocate really look into this and really study and know the literature, know what is out there. And if your provider just sort of casts you off as this being normal, then find someone who will really listen to you. I agree. Do you also feel, one question I wanted to ask you, that there might be a stigma culturally and with some cultures related to hormone replacement therapy, or that maybe people just don't want to talk about it? Because I know in Asian cultures and, we just don't talk about it.
Sure. Yeah. A lot of things are private, especially when you talked about how you found your vagina again. That's not in a gynecology practice. That's, there's nothing taboo. We talk about everything. But many people are very embarrassed. Now, again, looking at studies, what we find is that 2/3 don't even ask a sexual history. And that's important for a person, but sometimes people can't really bring that to their healthcare provider. That's another reason that we use this health assessment sheet, because it helps in private pull out information that may be uncomfortable to discuss. But you're right. You have to, sort of read the room a little bit and understand your client and how to approach those things. It's not that they don't want help in that area. It's that sometimes it's just difficult for them to march right in, especially if they have a male provider, to march right in and openly discuss those things.
Yeah, I would agree with that. This has been so insightful. Dr. Stacy, is there anything else that you'd like to share that you feel we might not have covered regarding hormones?
I think we covered things pretty well. It's just that there is a difference between synthetic and bioidentical. Estrogen is synthetic. Estradiol is bioidentical. So it's important to know what you're taking, what's going in your body, find what works for you. If you've had failed results or you're just afraid of the synthetics, then I would encourage you to talk to someone about the use of bioidenticals.
Yeah, I agree. Don't take no for an answer if you know intuitively that something is going on. Again, be an advocate.
Absolutely.
Right? Thank you so much, Dr. Stacy, for being here. And for those that are watching that would like to find you, how could they reach out to you?
Well, I'm all the way in Texas. So if they want to come see me, I'm in a little spot called Early, Texas. And my clinic is called BioEnvy, BIOENVE. You can find us online at bioenvy.com. But again, I am typically at headquarters in Irving, Texas, or Dallas, Texas, at BioT Medical.
Amazing. Thank you so much.
You're welcome.
This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.